we know that there could be psychological factors that can cause chronic constipation. And initially discussing with the general practitioner or with the gastroenterologist, they may be able to refer to the psychologist or psychiatrist to go through the psychological evaluations and assessments. So that can rule out or pinpoint the chronic causes for chronic constipation. So in this section, we have two parts: psychological evaluation and stress assessment, and second is behavioral and cognitive assessments. So let's begin with psychological evaluation and stress assessment. So the purpose is to evaluate stress levels, anxiety, depression, and psychological factors that may contribute to constipation. Because psychological factors such as stress, anxiety, and depression can significantly impact gastrointestinal function. High stress level can lead to muscle tension and altered gut motility, which again contributes to constipation. So this evaluation includes mental health through standardized questionnaire and interviews to identify the levels of stress, anxiety, and depression. So that's why we also recommend to keep a record of your mood, stress, and anxiety level so that the more data you have, and then there is an exacerbation of symptoms, it's easier to pinpoint when was the exact start date and the level of severity of that particular symptoms. So this is conducted two ways. One is standardized questionnaire. You may be asked to fill forms such as the big depression inventory or generalized anxiety disorder scale. So in my annual visit, they ask for this standardized questionnaire for a depression screening. And second is clinical interviews, or psychologist or psychiatrist conducts in-depth interviews to understand your mental health status and identify psychological issues affecting your gut health. Again, this assessment is conducted if you're a general practitioner, suspect that there are psychological factors, or also gastroenterologists suspect that there are psychological factors that might be contributing to constipation, or if you have the history of mental health or uh, psychological health. Now, let's talk about behavioral and cognitive assessments. The purpose of this assessment is to identify behavioral patterns and cognitive issues that might affect the bowel habits and gut health. Because behavioral and cognitive patterns, such as poor eating habit, lack of exercise, negative thoughts about bowel movements, can contribute to chronic constipation. Understanding these patterns can help in developing strategies to improve gut health and alleviate chronic constipation. So, this assessment involves analyzing daily habits, behaviors, thought processes related to eating, physical activity, and bowel movements. So, this is done to two ways. One is behavioral analysis. What you do is you keep a diary of documenting your daily routines, eating habits, physical activity, and bowel movements. Second is cognitive assessment. A psychologist may use cognitive test therapy techniques to identify and address negative thoughts, patterns, and behavior affecting your gut health. So, behavioral health assessment and cognitive assessment are recommended if your lifestyle changes and initial medical treatments do not alleviate constipation. That indicate that there is a deeper psychological factors may be involved. So, it may be recommended by your GP or your gastroenterologist. Again, understanding psychological factors contributing to chronic constipation is crucial for comprehensive treatment, the personalized treatment, and psychological assessment in managing chronic constipation is essential, useful to rule out and pinpoint the psychological reasons.